Do your hips crack and pop like mine? If so, stay tuned for today's video. In today's video, we're looking at snapping and popping in the hip joint. It's really important to know that noises often come from our body, and the hip joint is another one of these joints that for many people it pops and snaps. There can be different reasons for this. Sometimes it's the joint itself actually popping and releasing pressure. Sometimes there are conditions called internal and external snapping hip, where some of our tendons, our hip flexor tendons on the outside of the hip actually slip over different bony prominences, and it can create this sort of snapping feeling. In most cases, these aren't an issue, but if you have pain associated with popping or snapping in your hip, or you've had a recent injury and you're noticing some of these new sounds, then in today's video, I'm going to show a few exercises that can help reduce some of these symptoms. The first two exercises are going to be for the hip flexor muscles. They attach on the inside of our femur bone on a spot called the lesser trochanter, a bony prominence. As I said, sometimes when people are lifting their leg up and down, they'll feel a snapping, kind of a clunk in the front of their hip, and that is often related to the hip flexor tendons. Again, not usually an issue, but if it bothers you, then these first two exercises can help. So for the first exercise, we're going to stretch the hip flexors. One of the thoughts is if we can make that muscle group more flexible, take some tension off it, maybe it'll be less likely to snap over the bone. So what you're going to do for this one is put the leg that you want, that you have the snapping in, put the knee down on that side, and then you're going to tighten your abs and tighten your glutes. Doing this will help to rotate the pelvis into posterior pelvic tilt. And then you can hold onto a wall if you need to for balance. You're going to shift forward until you feel a stretch right here on the front of your hip. So that stretch will be in the hip flexor muscle group. The hip flexors attach on our low back, so deep inside on the lumbar spine, and then they run through the abdomen down to, again, the front of the femur, kind of deep in the groin. So if you have pain there or snapping that region, stretching this muscle group can help. If this is too easy, you can make it more challenging by grabbing your ankle and bending the knee. This will, again, stretch the hip flexors and stretch the quads on the front of the thigh. So I'm definitely tighter with this knee bend position, but in either case, you could even do both. Do one version here, hold 15 to 30 seconds, and then you could switch to the knee bent version. With most of these stretches, we want to try and perform them 2 to 4 times to really improve flexibility, and you want to try and do them every 24 hours or every day. So I usually like to do these things on both sides, but if you just have snapping hip on one side, then obviously you want to focus on that side. So that's our first exercise, a hip flexor stretch. For our second exercise, we're going to use a loop band to strengthen the hip flexors, that same muscle group. Oftentimes, if we can strengthen this muscle group, snapping and popping and things will reduce and pain will get better. A lot of people don't strengthen their hip flexors, and these are the antagonistic muscle to our glutes, and most people will focus on strengthening their glutes with bridges and squats. So you really want to target the hip flexors and create that balance around the hip joint. So for this one, you're going to take a loop band. I'll put a link down in the description if you want to get some of these. You're going to put the band around your feet, and then if I'm targeting my right hip, I'm going to lie on my back, keep my left leg straight, and then I'm going to pull the band up sort of like I'm marching up as high as you can. Usually people will get to around 90 degrees here at their hip joint, and then slowly go back down, and then just pull back up. This is a strengthening exercise. So you're going to go for 3 sets of 10 to 15 repetitions, perform a little hold at the top, an isometric hold, and then go back down slowly. You should really feel fatigue here on the front of the hip joint where those hip flexor muscles are. Okay, so this is, because it's a strengthening one, I also really like to do this on both sides. Even if you only have snapping and popping in one hip, it's good to do on both sides. Okay, so that's our second exercise, a banded hip flexor march. Before I get into the next exercise, just want to mention that my book is available on Amazon and Barnes & Noble. It has rehab programs for the 50 most common pain issues and injuries. When we're thinking about the hip joint and popping and snapping in the hip, one of the programs that can be really useful in the book is the hip joint pain program. All of the programs in the book are going to have a description, talk about signs and symptoms, the prognosis, and the treatment strategy. And then the program will take you through 3 phases of rehab with pictures of me doing the exercises and instructions for each exercise. Again, the programs are broken into 3 phases and allow you to do your own rehab at home. So if you'd like to have a resource to keep on hand for the most common issues, I will put a link for my book down in the description. The next 2 exercises will be for snapping hip on the outside of the hip, or external snapping hip syndrome, which has to do more with our IT band and the attachment of our glutes. So for this first exercise, we're going to do a glute stretch. So for this one, you're going to lie on your back and start with both legs out straight. Then the side that you're not stretching, you're going to bend up so that your foot's on the ground. The side, my right leg here that I'm going to stretch, I'm going to cross that over into this figure 4 position. And then from here, I'm going to reach down with my arms and grab the knee on the other leg and then pull everything up until I feel a stretch on my right leg here on sort of the buttock area towards the outside of the hip. And then I'm just going to hold there again for 15 to 30 seconds, stretching the gluteal muscles and some of the deep rotators. All of those structures that attach on the outside of the hip, again, can help improve flexibility and reduce tension in those muscles, and often can help reduce snapping on the outside of the hip. So again, with stretching, you've got to do this every 24 hours to improve flexibility. So really try to get 2 to 4 of these in each day. Hold that one side, then you can alternate to the other. You can just kick your leg over, reach down again, and then lie your head back, pull up, and look for that good stretch in the glute region. All right, so that is our third exercise, a gluteal stretch. For the fourth exercise, we're now going to use our loop band again to strengthen the external rotators of our hip joint and our glutes. Like we did for the hip flexor, we'll have a stretch and a strengthening exercise. Now for the outside of the hip, we just did a stretch. Now we'll have a strengthening exercise. So for this one, you're going to take the band, again, put it around both legs, but bring it up to around the knee joints. And then I'm going to be targeting my right leg. The leg that you're targeting will be on top. So I'm going to lie down on my left side and stack my legs. This is the classic clamshell exercise a lot of people know of. Your legs are going to be stacked, and you're going to open your knees while keeping your feet together. So this strengthens, again, the external rotators and my hip abductors up here on the top of the hip. And those muscles, many of them attach right out here on the outside of the hip on the greater trochanter, which is where people tend to get snapping hip syndrome, external snapping hip syndrome. So strengthening these muscles can help to relieve pain out here and reduce some of those snapping symptoms if you're getting them. So this one is a strengthening exercise again, so look at going for 3 sets of 10 to 15 repetitions. Anytime you do a strengthening exercise, you're just trying to do repetitions until you hit fatigue. If you have a band that's too easy, then just pick a different color, pick one that's stronger and leads to more fatigue. Okay, so that is our fourth exercise, a banded clamshell. The last exercise is going to be a standing exercise to really work on neuromuscular control and strength throughout the hip joint and some of the knee muscles. This is called a skater squat, and it really, again, is going to work the quads and the glutes. When people have snapping in the hip, especially snapping on the outside of the hip, often they will notice, we will see in the clinic when we observe them walking or running, that their leg deviates in. It may have internal rotation and adduction at the hip joint, and that places abnormal tensile forces on the outside of the hip. So one thing you can do is, just when you're walking and running, try to pay attention to, do you feel like that leg is deviating in when you contact the ground? And then what you can do is add an exercise like the skater squat to help strengthen those muscles and improve control. So what you're going to do is stand on the leg that has the snapping symptoms, and you're going to perform a single leg squat, leaning your trunk forward a little bit. And in this view, you're really trying to not let that knee cave in past the inside of the foot. So you're really trying to work on control of the femur, of this thigh bone, in the frontal or side-to-side plane. So you're trying to keep it over your foot and maintain control, moving nice and slow. And what you'll see from the side angle is you want to stick your butt back and kind of lean your trunk. This puts more of the challenge on the glute muscles and the hip joint, versus if I keep my trunk upright, it'll put more of the stress on my knee. So I want to lean forward into kind of that skater, kind of speed skater position, and just go down as far as I feel comfortable, hold a little bit at the bottom, and again, think about sitting back, but also controlling that knee joint, trying to keep it stable over the foot. For this one, again, go for 3 sets of 10 to 15 repetitions, and I definitely recommend doing it on both sides. It's a great exercise for building strength and improving balance. Okay, guys, those are 5 exercises for snapping and popping in the hip joint, whether it's coming from some of the surrounding tendons or from the joint itself. If you have any questions, put them down in the comment section, and I'll see you in the next video. Bye.